forward. Senator Britt, do you have any additional questions?
Yes, thank you so much, Madam Chairman. I just wanted to ask a couple of process questions, specifically first about definitions. I am an attorney by trade, so I have learned that definitions matter. And just want to know from your perspective, the definition of homelessness for HUD programs includes people living on the street or other places not meant for human habitation, in emergency shelters or in transitional housing. Additionally, that differs from some other federal programs, such as the Department of Education's Education for Homeless Children and Youth program, which considers a student that's experiencing homelessness if they're, quote, doubled up on family or friends' couches or staying there for economic reasons. I've also heard when we're talking about rural communities, we're talking about the underhoused, and so we've used several different definitions. My question to you is, in your experience, have these different definitions created an impediment to success, or would conforming them or creating a more comprehensive definition help you be able to better coordinate across multiple agencies and resources? Yeah, both of you.
I'll take that first, just because it is HUD's definition that you referred to, Senator. Thank you for that question. We have different definitions of homelessness between HUD and Department of Education because they largely serve different purposes. Our definition informs who we count on the point-in-time counts, but it also informs who's eligible for the roughly $3 billion in homeless assistance grants. That is out of a much larger HUD budget and set of programs that we administer. Education's definition largely governs the rights of children and students and their access to educational supports if they're experiencing homelessness or housing instability. And so schools have an obligation to provide continuing education for students regardless of their housing instability. I don't think that necessarily changing the definitions will solve the problem because essentially many of the doubled up families and families who are experiencing homelessness already are eligible for many of HUD's other larger homeless assistance programs, our affordable housing, our multifamily programs, housing vouchers, and public housing. The challenge is that there's not enough vouchers in public housing and affordable housing to meet their need. Simply just redefining them to make them eligible for HUD's much smaller set of programs isn't going to necessarily meet their needs, particularly because that program is not necessarily growing. I think the answer is ensuring that homeless families who are doubled up or experiencing housing instability have access to affordable housing, and that is going to take investments across all of HUD's programs.
Thank you so much, Dr. Chow. And from your perspective, obviously being the executive director for the United States Interagency Council on Homelessness, you probably have a different perspective with regards to dealing with different resources and agencies and others. What are your thoughts on that?
Our council is comprised of 19 federal agencies,
Woo!
And it's our job to help point them in the same direction around homelessness strategy. And so this is a question we deal with all the time. And at the community level, I've worked in programs that have been funded by Health and Human Services, the VA, HUD, Department of Ed, and probably many others. And what we see is at the community level, agencies are pretty sophisticated at blending and braiding funding streams to serve the populations that they're serving. The reality is that human beings are bigger than these definitions, and they are more than their housing status. And so if we're looking in rural Alabama or Wyoming versus Trenton, New Jersey, or San Francisco, California, it looks very different, but it also looks different from month to month or year to year for people. There might be somebody who's doubled up now who's in a shelter 6 months from now, or somebody who's living in their car now who then is staying with friends and family next week. So I think of these definitions as really program eligibility lines. And so it helps Department of Ed cast a broader net for reaching all of the children they're trying to serve in the education setting, or for community health centers that are serving people through Healthcare for the Homeless grants to be able to reach as many people as possible, including a broader swath of folks who might be doubled up. As Dr. Cho said, the HUD programmatic lines are very targeted. And so the tighter kind of conception of who's eligible for those programs, I think, I'm not going to speak for HUD, but allows a more narrow targeting of where those dollars go.
Thank you so much. And lastly, just want to thank you. When we look at what is happening with our veteran population, and you both referenced getting more and more veterans out of homelessness and back having, the pride and dignity of moving forward on their own. I believe that our veterans are the best among us and put it all on the line and gave us their very best. It is certainly our turn to give them ours. And as you have dealt particularly with that population and with those different challenges, what have you seen to be the most effective within that community in helping them come back out of homelessness?
I think our work collectively between Congress, the executive branch, and communities across the country, especially VA, to solve veteran homelessness is a case study in what effective government and partnerships with communities looks like. A commitment to evidence-based practices, a commitment to working with urgency, and I think the importance of federal leadership as well. When we've seen VA secretaries make a public commitment to ending veteran homelessness, that matters, and that pushes that urgency down at the local VA medical center level and with their community partners. We've seen Secretary McDonough and Secretary Fudge make that public commitment when they first came into their offices to end veteran homelessness, and that sent a message widely across the nation to once again use the federal resources that Congress provided to make sure that no veteran is left on the streets and to prevent veteran homelessness. And we are seeing, again, that curve on veteran homelessness start to decline once again.
Thank you.
And if I could just briefly add to that, I think the work on veteran homelessness is one of the bright spots. It is bipartisan in nature. It's sustained over multiple presidential administrations, over a decade. We've seen a 55% reduction in homelessness in this population and 11% in the last 2 years. It takes the best of what HUD does and lets them do it. It takes the best of what the VA does and lets them do it. As you all probably know, Secretary McDonough is chairing our council right now. Secretary Fudge was our chair last year, and Secretary Becerra at HHS is our vice chair. That continuity across HUD, VA, HHS, and all of our other agencies is what's working. And I think we could take the veteran successes as a case study of how to do this with other populations.
Absolutely. Thank you. And thank you, Madam Chairman.
Thank you very much. Unless we have any other questions from the subcommittee, I want to thank our witnesses for being here today and for providing your testimony. For senators who wish to submit questions for the record, those questions are due 1 week from today, which will be Wednesday, March 15th. For our